Here we are with disaster preparedness and mitigation. Remember, I'm talking in terms of health system. So yes, disaster preparations in health systems and how do we mitigate it. We'll talk about natural born disaster as the pic shows and the man-made disaster thereby. So yes, what is the disaster preparedness? By definition, the activity is designed to minimize the loss of life and damages, to organize temporary removal of people and property from a threatened location, and facilitate timely and effective rescue and relief and probably rehabilitations. This is what the definition of disaster preparedness goes around it. Now, it can be an international agency, it can be a national agency conducting activities like planning, organizing, training, and communicating, educating the people to provide and prompt appropriate responses to prevent and reduces adverse effects altogether. Ongoing multi-sectoral activities integrate part of the national system and responsibility. Differences in developing and developed countries, infrastructures in terms of infrastructure, resources, management capacity, communication, and logistic problem thereby. So we need to keep those things in our mind while preparing for disasters mitigations and how do we prepare ourselves for it. The objective is very simple. It means to prevent excessive mortality by impact, rescue, relief, appropriate healthcare, and disruption thereby, to provide appropriate and most importantly timely healthcare for casualties, malnutrition, and communicable diseases, to prevent exposures to adverse climate and environmental conditions, to prevent long-term and probably short-term disaster-related morbidities, re-establishment of health services to or perhaps above the pre-disaster level. So general models of disaster preparedness plan as to identify the health hazards, identify the effects as to what quantum that they might magnify, assesses the likely needs, preliminary list local capacity, quantify the needs and considers basic requirement, discuss the needs, teams involved in planning process, determine the operation procedures and reviewing existing priorities, provide a particular framework, hazard prioritization, fundamental policies, set out goals approved by higher authorities, and delegations of responsibility thereof. This is most important. Let us talk about the general model of disaster preparedness plan, assigning the responsibility, making an inventory of the local capacity, and probably even assessing the available resources thereby. We need to review the step number 2 and 5 continuously, as in what are the resources available and who are the person managing those resources. Identify critical areas, strengthening and monitoring of plans, confirm priorities. Your priorities are needs, resources, and time. Finalize the plan, which should be easy to read, not rigid, should be flexible enough, standard layout. Practice the plan regularly to be reviewed, updated, responsible people should be identified, and if possible, we can look at the weak spots, identify the weakness, evaluate the plan. What have you learned from the plan and what have you applied? What have you learned from the plan is the previous disaster that you were looking into it. What have you applied is to the present disaster that you were actually planning to apply, so that the lacunae of the previous disaster mitigations is already taken care of in this time. Compile an information packages, demography. It should be comprising of demography, epidemiology, and GIS, geographical information system. So treatment of casualties, technical health program, right? First and foremost thing is pre-hospitalization care. Search and rescue victim, first aid at promptly at the disaster site. Next comes the hospital plan, emergency plan, training and information, safety of the patients, the health personnel, backup of the system. And when I say backup of the system, I'm talking about water, power, communication, transportation. Everything needs to be identified. Talking about identification of bodies as in coordination with the FM or the managers out there of the project, protocol for identification and transport, epidemiological surveys and diseases control, which is all about taking simple data collection, warning mechanism with the list of potential illness, special programs for diseases, basic sanitation and sanitary, engineering, collaboration with different department and contingency plan thereby. So these are the things that you should be keeping in mind every time. Health management in shelters or temporary settlement, control of infectious diseases, vaccination of children, nutritious surveillance, training health personnel and public health management, in-service training, professional staff, professional curriculum, research, officers' ongoing information. Then comes the logistic resources, as in budget and networking. Simulation exercises is all about desktop field exercises and the drills thereby. What are we looking out here? This needs to be taken into consideration. Talking about the health education, temporary transfer of population from the areas of risk to another safer area, that is organized in terms of tropical storm, air attack, military action, industrial accident. Spontaneous example might be flood, droughts, chemical or nuclear accidents. Environmental health services is a short-term travel, clean, potable, drinkable water, excreta, solid waste, rest stops, and knowledge. Disaster warning, simple language, clear, exact nature of the message, restore the radio and broadcasting scenario as fast as possible. Health policies and legislations to develop preparedness and responses plan, routine simulation, assigning financial resources, coordination mechanism, health disaster coordinator in charge of preparedness activities. We're talking about coordinating the plan with government, international agencies, NGOs, and other departments, water, housing, communication. We talk about communications and coordination with WHO or civil prior protection agencies, emergency preparedness program. Thereby, this is what we need to go across with it. Now, let us come on to the mitigation and probably the prevention part as far as the health angle is concerned. Remember, mitigations and preventions are defined as an action aimed at reducing or probably eliminating the impact of future hazards by avoiding hazards altogether or strengthening the resistance to it. Objective, reduce vulnerability of the system as in improving and enforcing building codes, reducing magnitude of hazard, diverting the flow of river. Vulnerability and capacity assessment. It is a degree to which population, individuals, or organization is unable to anticipate, cope up with, resist, and recover from the impact of disaster. Risk or threat assessment to identify hazards and the possible effects, capacity to prevent and respond, develop strategies, emergency prevention, mitigations, preparedness measures, rapid, relevant emergency responses, and definitely there are gaps in resources. Obviously, yes. So, what are we looking into it? How do we reduce vulnerability? First and foremost, you need to develop a policy about what to do in case of specific disaster. Then, probably, if a specific disaster, assess the vulnerability. One way to assess is to prevent those disasters from happening, and the other way is to prepare if the disaster has happened, what to do the next step, and that would be enabling you or muscling you for the reduction of vulnerability thereby. So, steps in vulnerability analysis. How do we go around it? Determine the aim, the objectives, and the scope and the context of the vulnerability assessment. What are we looking into it? Formation of the planning group as hazard identification and description, community and environmental descriptions, determining effects, community vulnerability, hazard prioritization, recommendation for action, documentation of result, probably of decisions too. Mitigation program, identify areas exposed to natural hazard with the help of specialists. Coordinate the work of multidisciplinary teams in developing, designing, and building codes. Include disaster mitigation in health sector. Identify the priority hospital and critical health facility, current building and standards, and probable codes thereby. Mitigation program is to ensure disaster mitigation measures in maintenance plan, in structural modification, in functional aspects. Inform and sensitize, if possible, train those personnel involved in planning, administering, and operations and maintenance. Include disaster mitigation in the curriculum of the professional training institute, including in the construction, maintenance, administration, financing, planning of a health facility thereby. Health facilities is all that we are looking into it because it means of preventing the loss of life and the hospital function. It should be structural, non-structural, or administrative or organizational. How do we want to address it? The drinking water, sewage supply, what happens around it. We need to talk about the disposal of the sewage system. We need to talk about the mitigation to reduce the community vulnerability altogether. So let us start with the structural vulnerability, part of the building required for support, as in foundation, columns, beams, diaphragm, supporting walls as on when on basis. What about non-structural vulnerability joined in the building structure? Example, windows and doors. Building functionality, example, plumbing, air conditioning, power, water, communication. Items located within the building is the medical and furniture and the equipments of medicals. Administrative and organization vulnerability. Physical design is all about external site, internal distribution of space and access route. Physical and functional relationship with different sectors. Example, hiring, maintenance, and supply. Administrative and operational facilities, disaster management, and simulation exercises thereby. What are we looking into it? To start with the low cost measures, non-structural, implement those measures at the national level, at the local level, at the provincial level, with everyone getting involved, be the client, owner, finance officer, technical personnel. Measure the total cost should be around 4 to 8%. In case there's a failure of system, this is what we need to go around it. Disaster mitigation in water supply and sewage system. Water supply and sewage system is one of the most vulnerable areas that goes around it. If they mix together, it becomes a disaster altogether, a disaster of a different magnitude. So outbreak of communicable diseases and sanitary deteriorates. Example, Mexico City in 1985. Strategies to quickly and effectively restore the system. Hazard analysis by team. Focus on the operation maintenances, administrative and impact on services. Mitigation measures in master plan. Measures, retrofitting, replacement, repair, backup equipment, relocations of component, rigid joints and flexibility thereby. What are we looking to reduce the community vulnerability, reduce risk of communicable diseases, improve general health status of population? Water and sanitation projects organized by self-help bases. Example, community-based organizations. Local emergency planning in disaster, public education, discussions with water vendor, interventions by governments and municipal authorities in industrial plant coordinations, contamination. With this, I come to an end of this video. Thank you for watching the video till the end.